Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hello, I'm Bill Powderly from Washington University in St. Louis, and welcome to episode 2 of Clinical Clips from the European AIDS Clinical Conference in Warsaw. The combination of cabotegravir and rilpivirine, which is given by injection on an intermittent basis, has become quite popular among patients with long-standing HIV disease. And a study from the Dutch Athena cohort evaluated the risk of failure with this regimen. The Athena cohort is interesting because it captures 98% of patients with HIV treated in the Netherlands. So it's a very complete nationwide study. They looked at 619 patients who were treated with rilpivirine cabotegravir by injection and compared them to approximately 1,200 matched controls. And the rate of failure in the follow-up was reassuringly low. 0.9% of patients who received the injection compared to 1.8% of patients in the matched control group. So in general, this is consistent with clinical trials that led to the approval of this agent. However, one caveat that has to be noted was when they examined the failures virologically, several patients, for unexplained reasons, had multi-drug resistance to both classes, which significantly limits options for those patients as they move forward. This was not yet explained in terms of what exactly led to it. Some, but not all of the patients had low drug levels. So this is an important issue that needs to be further studied. This reminds us of the fact that we need to continue to develop new drugs. And 2 trials were presented of the investigational maturation inhibitor, GSK 0254. These were phase 2b trials looking at dose finding and comparing it to dolutegravir 3TC as a baseline regimen. In general, the maturation inhibitor cohorts had virological responses at 24 weeks that were comparable to the dolutegravir controls. Approximately 92% of patients receiving the dolutegravir-based regimen had viral suppression, and with the maturation inhibitor, it ranged from 78 to 91%. Similarly, CD4 counts responses were robust in all patients. For commercial reasons, this particular agent is not going to be developed. However, these studies show a proof of concept for this class of drugs, and the next generation of this class of drugs will be a long-acting maturation inhibitor that can be given probably by injection with other long-acting treatments. And we look forward to seeing the results of those clinical trials. There has been much interest in the simplification regimens, particularly the dolutegravir 3TC regimen, which has been shown to be a successful regimen for simplification after initial therapy with the 3-drug regimen. An interesting study from Rome looked retrospectively at patients who had been virologically suppressed and were switched to a regimen of dolutegravir 3TC, and found, somewhat surprisingly, that if patients had concomitant hepatitis B, they were twice as likely to fail to maintain suppression. The mechanisms of this aren't clear, and it clearly is a retrospective study and warrants further investigation and replication at other sites. But it does remind us that when we look at clinical trials and translate them into the real world, that there are patient differences that we may not completely understand or may not be included in clinical trials. And it is important to continue to follow patients very closely when changing their antiviral regimen. Thank you for joining us for the second and final clip from EACS 2023. Please visit the landing page to view slides and the previous clip from this conference.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.